Hi, my name is Ashley Newell Thomas, and this is my presentation on simulation and how it is used in healthcare. Simulation is described in our text as a trial and error method of teaching whereby an artificial or hypothetical experience is created that engages the learner in an activity that reflects real-life conditions of an actual situation. In other words, a real-life experience is replicated as a means of learning skill sets in a controlled environment. This is commonly used in various settings, particularly within the healthcare field, and can be used with students, healthcare workers, and even patients. There are four main types of simulation, first being written. This commonly includes case studies where learners are given a written scenario and then are assessed on their response through various questions. Second would be clinical. This is what we tend to think of when we think of simulation and includes hands-on, real-life clinical scenarios that are replicated for a collaborative response. Third is model. This is where the actor would be a patient, and it is commonly used for a variety of audiences. And then fourth would be computer, which obviously includes computerized scenarios for learners. Simulation typically falls under the psychomotor or skills learning domain. Psychomotor involves learning with fine and gross motor abilities, which is consistent with simulation as learners are gaining knowledge through practice of real-life scenarios. Cognitive and affective domains are also necessary in order for the development of psychomotor skills to take place. And psychomotor may not always be involved in simulation, as some forms are not hands-on, such as the written or computer simulations that we discussed earlier. The cognitive domain refers to the thinking and understanding learning domain. This is a critical aspect of simulation, and it requires that simulation be supported by discussion or debriefing afterwards. This feature ensures the connection of theory being applied to simulation, and it is more predominant in forms of simulation that are not hands-on, such as the written or computer simulations. And it also encourages critical thinking and high-level decision-making skills. Simulation also encompasses an aspect of the affective domain, and this would refer to the feeling element of learning and the emotional responses. The affective component conveys recognition of the value or worth of skills being learned, according to our text. It focuses on the learner's own connection to the knowledge being gained and how they feel about it. This can be quite significant in simulation, as real-life situations may bring out strong emotional responses from the learner. I've also included a piece on constructivism learning theory, as it is very closely correlated with simulation. The constructivism learning theory focuses on learning through developing one's own process, using critical thinking and analysis rather than simply relaying material. And it focuses on learning through collaboration with others to go beyond the structured information. Simulation fully embraces this theory by allowing the learner to process information through experience followed by reflection. It also contributes to why simulation is effective in teaching more complex thought processes or information. I have listed here some pros of simulation, one being that it's more effective for psychomotor skill development. It also helps in developing critical thinking, analysis, and decision-making at a higher level. It offers variation within situations, including potential consequences, and it's able to do so in a safe and controlled environment. Another advantage is that it's more engaging a method than traditional techniques. It also enhances collaboration and teamwork of healthcare workers. It can offer better insight for preparation of real-life experiences. It also offers alternative learning approach. It does so by reinforcing information taught in other forms and is much more effective for kinesthetic learners. I only have a few cons of simulation listed here, one being that it can be quite expensive. This is especially true in areas that require more technology, equipment, and supplies. It can also be very time-consuming within the development and preparation of simulations, as well as the maintenance and training for supplies and equipment. Because of these two things, simulation may not always be available, especially at smaller schools or organizations where the funds simply aren't there. Some examples of simulation within healthcare. With students, simulation labs are very common, and they're used in conjunction with lecture and clinical experiences. This can be true for complex situations or simple skill learning. Some examples might be how to respond to a deteriorating patient, practicing or learning Foley insertion, calling physicians, or might also include case studies within the classroom setting. In terms of healthcare workers, it is commonly used for complex situations involving interdisciplinary teamwork. The best example of this is probably with Code Blue or rapid response situations. I know here at LGH we do something called First Five. That's where the educators come around to the floors and practice what happens within the first 5 minutes of a code, so that we are familiar with that, and it's something that we're expected to do at least annually, if not more often. Other examples might include disaster drills or active shooter drills. And it can also be used for patients for anticipatory learning involving various skills. This could include CPR classes, troubleshooting various complications if patients go home with devices such as PEG tubes or Foleys or central lines. That is pretty much the end of my presentation. I also wanted to include a video. I'm not quite sure how to do it within this video itself, but I'm also going to include the link in my Blackboard post, so I hope that you guys will check that out. This is a video of simulation from UC San Diego Medical Center that they use to practice for a code-like situation. Thanks so much for listening.